Hi, I'm Chris Harper, and with me is John, and we're here to demonstrate an application for the acromioclavicular joint, otherwise known as the AC joint. The AC joint is where the collarbone and shoulder blade meet, and I'll just place a red dot where that is on the body. Your pain may vary slightly, but we'll just put a dot there to indicate where that may be. Some causes of this may be collisions involving the top of the shoulder or separations causing ligament damage. KT tape helps treat this condition by relieving pressure to reduce pain, provide support, and may increase circulation to the inflamed area. For this application, we're going to position the body. Have you turn just away from me slightly. We're going to let that arm drop by the side. We're going to make sure we're in really good posture. We also want to stretch the skin between the shoulder and neck, so we're going to turn the head away and looking down. For the first part of this application, I'm going to take one full strip. I'm going to fold this in half, and I'm going to cut rounded corners. The rounded corners help prevent the tape getting caught on clothing when taking clothing on and off. For this first strip, I'm going to twist and tear the backer paper. Peeling that back, I'm being very careful not to touch the adhesive of the tape. When I stretch this piece, I'm going to stretch it with very even pressure with my thumb, so I'm not going to grip it in the middle, but rather flat pressure like this. I'm going to stretch this to 80%. So if I stretch 100%, I'm just going to back that off just a little bit and apply that down. Now I'm only applying stretch to the middle of the tape. These ends I'm just going to lay down with absolutely zero stretch. I'm going to give that a little bit of friction just to create some heat and get that to adhere well. For the next piece, I'm going to take that other half of the strip that I already cut, tearing it in the middle, as I did with the first piece. Again, nice even pressure. I'm going to make a plus sign right over that first piece and right over the center of that joint. I'm going to rub that on. I'm going to peel that paper off, laying those ends down with absolutely zero stretch. Again, be very careful when taping between the shoulder and neck. The skin tends to be sensitive here, plus it moves quite a bit. You don't want to cause irritation there. Okay, for my next part, I'm going to take another full strip. Just like the first one, I'm folding this one in half, and I'm cutting rounded corners just to get rid of the sharp corners. That way it doesn't get caught on clothing. Okay, for this next piece, just like the first two, I'm tearing down the middle, being careful not to touch the adhesive, applying nice even pressure, 80% stretch. I'm just crossing over the first two pieces. And again, I'm laying down these ends with absolutely zero tension. I'm going to give that a little bit of a rub so it adheres well. My final piece, I'm going to tear down the middle. Again, nice even pressure. Applying that right over, making a plus sign of that third piece I put on, and applying that down with zero stretch on the ends. Going to give the whole thing a good friction rub that creates a little heat and allows that adhesive to activate and really stick to the skin. Some helpful tips before applying. Make sure you clean the skin very well to remove any lotions or oils you may have on. Be careful with taking clothing on or off, as this may roll the tape. And you can also combine this with the shoulder stability application for maximal effect. Some complementary treatments may include ice, rest, anti-inflammatory medications such as ibuprofen, and also please seek care if you are experiencing swelling or extreme pain, or if you suspect a separation or dislocation. For more information, see our website at kttape.com.